At least 41 million children under the age of 5 are obese or overweight, with the greatest rise in these numbers coming from low and middle income countries. Now, according to a recent World Health Organization report, many children are growing up today in environments encouraging weight gain and obesity. The marketing of unhealthy foods and non-alcoholic beverages has been identified as a major factor in the increase of children being overweight and obese, this particularly in developing countries.
Now, earlier today on Newsroom, we spoke to Dr. Louise Barber. Dr. Barber represents the World Health Organization in South Africa.
The report aims to highlight the problem of obesity and overweight in children, particularly children under 5, which, as you have just mentioned, has increased dramatically. And this increase is being driven by low and middle income countries. The problem, as you have already stated, is really the environment. We're living in environments where there are more and more processed foods. These processed foods are cheaper in many cases than healthier alternatives. We have aggressive and sophisticated marketing techniques, particularly towards children, to increase consumption of these energy-dense, high-fat, high-sugar foods. As well as we have an environment where people have insufficient information to make food choices. So, for example, the nutrition labeling tends to be small, difficult to read, and even more difficult to interpret. So these factors have really created an environment that we call an obesogenic environment, and an environment that encourages increased consumptions of foods that are unhealthy.
Tell us about the impact on the quality of life that obesity brings to a young child, but also later in life.
That's right. I think a young child who is obese finds it very difficult. Frequently, they don't access the weight management services that they need. They could be bullied at school, and frequently children who are overweight become overweight and continue to be overweight and obese during adolescence and adulthood. And this has very serious health consequences. We see that these kind of consequences could include increased cardiovascular disease, increased heart disease, diabetes, hypertension, as well as some cancers, as well as degenerative joint diseases. So the health consequences are very, very severe.
What about the economic burden of this and the diseases that go with it?
Well, that's right. I think we have to look at the health costs involved in treating these chronic diseases, particularly diabetes and hypertension. They cause a very high burden to the health systems, as well as the individuals who have to continually pay for medical treatment for the rest of their lives. So the costs are severe to the health of the individuals, as well as the communities and societies as a whole. When people are sick, they are less productive. They may have higher absenteeism and have lower quality of life.
Dr. Barber, we see that the problem is escalating in the developing world, if one can generalize like that. What does that say about what is happening in the developing world? Do you see an issue with parenting, maybe?
Well, I think what the report emphasizes is less the individual behaviors as opposed to the environment. What we've done is create environments that promotes unhealthy behaviors. We have communities, for example, in which people can't exercise. And this is one of the major recommendations of the report, to create an environment where it's easy for people to make healthy choices. It's easy for people to choose affordable, healthy food. It's easy for individuals to go out into their communities. They have parks, they have bike paths, they can exercise easily. And it's part and parcel of a normal environment, living environment.
The report also mentioned that the political will and commitment can help immediately to alleviate this challenge. How so?
Well, one of the major recommendations, two of the major recommendations, in fact, are about increasing the availability of healthy foods and reducing the availability of unhealthy foods. So this involves things like price and tax measures. As you mentioned, we can use price and tax measures. When you tax a product, its price increases, so this essentially becomes less affordable. So there are many initiatives to promote taxes, sales taxes, value-added taxes or excises on sugar drinks, on candies, on confections, so that these products are less affordable and less available. At the same time, when you tax something, you do generate revenues, and these revenues can be used to subsidize, for example, the production of fruits and vegetables.
In children.